So this is Dr. Khan. I a board certified plastic surgeon, executive plastic surgery. So I just got this question, is it safe to proceed with what is awake surgery? This is one of the popular shows on Netflix/Hulu. And the question is this something reasonable? So there is something what is called a total local block, where a nerve block is administered, where the nerves basically are all contained and the patient does not feel literally anything, because there is a very nice effective nerve block that is administered. Now, I will say this as a board certified plastic surgeon and a board certified general surgeon, it is not safe in a sense that post-op the patient may hear discussions with the plastic surgeon and the assistants. For example, if there is some excessive bleeding, which absolutely can occur, or there are any issues during the case, you do not want to be hearing what your surgeon is doing or talking about, or any movements. For example, during liposuction, you can actually hear or feel that there might be some pressure on the belly, and also you can imagine what would be the strokes of, for example, liposuction or even any surgery procedure. Post-operatively, the patient might have some trauma, a post-traumatic stress disorder, just from knowing that the fact that this is what occurred or what was heard. You hear from the many patients who got awake from the TV shows and heard what happened during the surgery but were not able to vocalize. So from a professional perspective, twilight is very safe and effective in the sense that the patient has complete amnesia, cannot hear, cannot listen. To date, look, as you will see, not a single patient will tell you that they recollected what happened during the surgery, or they heard, or they recalled the conversation between the surgeon or the assistant. General anesthesia is also safe, but the twilight anesthesia is certainly safer. And awake surgery sounds good, but in reality, if you ask me, is not a feasible, practical option. This is Dr. Khan, Executive Plastic Surgery.